So let's dive into how do we get new team members on board, when resigning from PPO plans. Well, one of the things we have to recognize is that if they're coming from dentistry, which of course many of our new hires are coming from dentistry, not all, because we've talked about the idea of going outside of dentistry
Right.
for positions that we can hire from outside of dentistry. Um, but let's assume most of them are coming from dentistry. It's highly likely that the only offices they've had any experience with have been PPO practices. And as a result, they haven't had the experience of a reduced insurance dependence practice or going all the way to fee for service. And if they're not familiar with it, what's human nature's response when something's new and we're not familiar with it? What's the human response?
Uh, to shy away from it.
We resist it. It's like,
Yeah.
oh, I don't know about that.
Right.
I'm not familiar with it. It's scary because it's something that's not familiar, right?
Right.
Uh, so first tip I want to offer is first of all, we need to talk to our team members about this. We need to involve them. We need to let them know why we're doing what we're doing, because that's a great way to get, to help them understand the purpose behind this. And when you're speaking with your team members, remember my favorite acronym, WIIFM. I like to jokingly say that's my favorite radio station. It does sound like it's a radio station with the last two letters being FM, but no, that's an acronym that stands for what's in it for me. And when I say what's in it for me, talk to your team members about what's in it for them. What are some things that could be in it for your team member? How about a more sane work schedule in your practice? Your team members experience the same dynamic that you experience, that you feel like you're a hamster on the treadmill and you feel like you have to pedal so fast to make this work because you're giving away 45 to 50% to the PPO plan. Your team members experience the same thing. So
Right.
talk to them about, hey, how would you like to experience a more sane work schedule where you could actually slow down and spend more time with our patients? Think about it for a minute, Aaron. Everything in the PPO practice model takes you away from relationship driven. Everything about that PPO model, where you got to pedal, 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 works against you spending more time with patients. Works against you getting to know them because you just have to strap roller skates on your feet, put jetpacks on the back of them, and shoosh up and down the hall all day. And that isn't the most rewarding way to work for you or your team members. So talk to them about what's in it for them. Secondly, talk to them about the fact that you want to make this always a state-of-the-art practice. You want to invest in latest technology. You want to invest in improvements in your practice that makes it a great environment for your patients to visit. And you can't do that if you're giving away 45 to 50%, to the insurance companies. And then third, talk to them about what's the possibility that the stronger the practice is financially, the more opportunity there is for our team members financially. You can't give from an empty wagon. So without making concrete promises, you can say, as the practice gets stronger, if this is part of your culture, it would be part of ours. We want to share the success of our practice with our team members. We can't do that if we're not having success.
Right.
So the stronger the practice gets, the more opportunity there is not only for us, but for our team members in terms of financial opportunities. And I think now you're going to start to see how this is getting momentum. Your team members are like, I'm liking this, I'm liking this, I'm liking this. But maybe the next one, especially for your admin team members, might really strike a nerve. Naren, when the dental insurance company doesn't do what it's supposed to do, let me use a classic example. The patient came in 5 months and 29 days after their last hygiene appointment for their next hygiene appointment, and somehow it slipped through the cracks. Hopefully you've got an internal system to catch that, and when we're scheduling, we make sure we're at least 6 months out. But let's say it slipped through the cracks. Who's the patient going to be upset about when the insurance company didn't pay the claim? Who are they going to be upset with?
Unfortunately, they would voice their upset with the team member and at the practice.
They might actually blame it on them.
Yeah.
Well, if you knew this, why did you schedule that for me
Yeah.
today?
Exactly.
They're not upset about the very ridiculous plan design that would deny a claim one day ahead of time.
Right.
They're not upset at their benefit supervisor at work because they bought a lousy plan. They're upset at you. How about we reduce those upsets and have less of that going on in the practice, upset about every little payment glitch that can happen with the insurance company. And in turn, have more conversations with our patients about how the recommended treatment is going to benefit them. Wouldn't you like to trade an arm wrestling conversation about how come this didn't get paid for with a discussion about, hey, I want to get those fillings replaced because I don't want to wait till it becomes something more complicated. Now talk to them about the benefits of that care, instead of some payment dispute, because those payment disputes are almost always levied at your team members.
Right.
And doctor, if you're not familiar with those, talk to your admin team members about how much flack they get from patients about this, because I think you might be surprised how much of that they do get. The next tip is devote some dedicated team meetings, a couple of them, to role playing and verbal skills. Talk about how we answer the phone when it says, do you take my insurance? How we communicate to our patients that we're no longer contracted with Delta.
Another thing that, go ahead, Gary.
We talk about, FAQs, frequently asked questions. If you've already dropped some plans, you should have a list of frequently asked questions. And we talk about how we all synchronize so we're on the same page when it comes to talking to our patients.
Another thing that I notice is, especially as these practices are getting phone calls from Google as opposed to from the PPO plan, most of those patients are not on a PPO, right? In other words, they are calling because they saw you on Google for a particular keyword they searched. So now you have an opportunity to provide high value services, where a patient might pay $5,000, $10,000. And those are all like pure profit, or what I mean is like, it's not like the low profit services, it's like high profit services. So it creates more opportunities for the team, the doctor, like to take care of
It
these
allows us to
patients.
do more of the dentistry we want to do.
Right.
Those services carry expenses as well. There's expenses involved in those services. Emotionally,
But there's no write-off, right? Like, for example, you make that $10,000, you're not going to give 45% to the Delta.
You are if you're in a PPO, because they set your fees for those.
True. Yes.
They still set your fees for services that aren't covered. That's one of my biggest complaints about. That's my biggest beef about PPO. Why in the world should they be able to set your fees on services that are uncovered? So if you're still in network, hopefully that will be strong motivation for you kicking that plan to the curb, because they should not be setting your veneer fees. They should not be setting your adult orthodontics fees. They should not be setting your smile design fees, because they're not going to pay anything on those.
Exactly.
But they are allowed to do that. You need to kick them to the curb. And then I like to say another great way to get your new team members on board is to do what I call the ultimate team meeting. And that's where you go around the room with everybody there and you ask each person to give a reason why patients should come to your office for their dental care. Give a reason. And then the rule is that they cannot have any repeat responses. And we go around the room. We go around the room twice, with the doctor being last. It's always hard to come up with the one that's last, so we'll make the doctor the tougher part on this one. And then we talk about what we learned as a team. And I think one of the things that meeting does is it gives a strong impression that, oh my God, why would anybody want to go anywhere else when we provide all these really cool benefits for our patients? So there's some tips to get your new team members on board. Perhaps most importantly, it's spend some dedicated time talking to your new team. Don't just assume they're going to draft and get this, because it might be very unfamiliar to them. But I think what you're going to find is new team members are going to be all on board once we spend some time helping them understand and let them know that many team members maybe don't know that when you sign up for a PPO plan, you're forced to set their fee. Show them what your fee is, say for a crown, fee for service, and what you receive from the PPO plan. Because many times, especially your clinical staff, are going to say, oh my God, that's ridiculous. But when you're hearing things like that from your team members, we know we're on the right track.